Good morning, my name is Dr. Sulman Ahmed and thank you for watching my video. Today we're going to talk a little bit about a gastric sleeve. What is a gastric sleeve? Well, a gastric sleeve is an operation to reduce 3/4 of the volume of your stomach. We do this operation with keyhole surgery, and that will involve 3 to 4 cuts on your tummy to then do the surgery with keyhole surgery. So this operation normally takes 1 to 2 hours to do. The operation generally involves 2 nights in hospital. You will then have an X-ray study the next day after the operation to make sure that there's flow of the dye that you will drink, but also to make sure that there's no evidence of a leak. So what are the risks with the operation? The risks of the operation include a few things, mainly bleeding, leaking from the stomach. So how much weight can I lose with the gastric sleeve operation? Most studies have shown that most patients will lose between 60 to 70% of their excess weight. What that means is your excess weight is what your weight is at the current height that you are, minus the weight that you should be with a BMI of 25. So that may mean that if you have 70 kilos as excess weight, these operations would generally on average give you 60 to 70% reduction in that excess weight, which is a substantial amount of weight. Is there anyone who can have the operation? Well, most patients generally will be eligible for an operation of this type. We generally use a number of parameters to assess patients. One is the BMI, and we generally would say that a BMI above 35 with a few comorbidities would allow you to be having that operation. You need to be of psychologically sound mind. You need to follow the pre-operative instructions, but also be able to participate in a post-operative program. So it is important that if these conditions are met and are thought to be met, then the patient should be eligible to have an operation. Is there anyone who can't have the operation? Well, generally if you don't meet the parameters and the guidelines to have the operation, we would then recommend for you not to have the operation. But also there are patients who may have had significant reflux in the past or currently have significant reflux, where then this operation may not be suitable and they may be better off having a gastric bypass. I'll go into this in a little bit more detail in the next video. Thank you.